Okay, let's dive in. Here's something that might surprise you. Did you know that when it comes to figuring out what might be wrong with you, some AI is performing just as well as, well, your average doctor?
It's pretty mind-blowing, isn't it? And for this deep dive, we're looking into a really thorough analysis that pulls together a whole lot of studies.
Yeah, it's trying to give us a clearer picture of how this, generative AI actually compares to physicians when it comes to making a diagnosis.
Exactly. It's a systematic review and meta-analysis, basically. They've rigorously gone through 83 different studies.
83. Wow. So our mission today is to unpack how these AI models really measure up against human doctors.
And this review, it was published in NTJ Digital Medicine, pretty reputable journal.
Good to know. And the studies themselves, are they recent?
They are. They cover research published between June 2018 and June 2024, so it's giving us a very current snapshot.
Okay, so what's the big problem they were trying to solve here? Why pull all this data together?
Well, there's just so much buzz around AI in medicine, right? But what was missing was a really solid, comprehensive look at how good generative AI actually is at diagnosis compared to doctors, like across the board.
Well, cutting through the hype to see the real performance.
Exactly. They wanted to fill that evidence gap.
So after crunching all the numbers from those 83 studies, what did they find? What's the headline?
Okay, so the overall diagnostic accuracy they calculated for generative AI was about 52.1%.
52%.
Uh,
How does that sit next to doctors?
well, here's the kicker. When they compared AI to physicians overall, there was actually no statistically significant difference.
Wait, really? No significant difference. So
Yeah.
broadly speaking, AI is performing kind of at a similar level.
Statistically speaking, yes. The data doesn't strongly point to one being definitively better than the other overall.
Huh, that's unexpected.
It is, and it gets even more interesting. They also compared the AI specifically to non-expert physicians. Think like general practitioners or doctors earlier in their training.
Okay.
Same story. No statistically significant difference found there either.
So AI is basically on par with your GP for figuring out what's wrong.
Based on this analysis of 83 studies, that seems to be the case, yeah? Some specific AI models even scored slightly higher, but not enough to be statistically significant.
Okay, but I feel a but coming. What about the specialists, the experienced expert?
Ah, yes. That's where the picture changes. When they compared generative AI to expert physicians, specialists deep in their field, the AI performed significantly worse.
Right, that makes intuitive sense, I guess.
It does. That deep, nuanced understanding, the years of seeing rare cases, AI isn't quite there yet compared to seasoned specialists.
So the key takeaway seems to be, generative AI is showing real promise. It can hang with non-specialist doctors, but it's definitely not outperforming the experts.
Precisely. It suggests AI could be a really useful assistant, maybe helping with initial checks, supporting doctors who aren't specialists in a particular area, maybe even in medical education.
But we need to be careful about its limits.
Absolutely. Especially for complex stuff where you really need that specialist insight, it's not ready to take over that role.
Okay, so wrapping this up, AI's diagnostic abilities are pretty impressive, holding their own against general practitioners. But the experienced specialists still clearly have the edge.
That's the long and short of it.
This really makes me think back to our last deep dive. We were talking about whether AI could replace radiologists.
Right. A field requiring huge expertise in interpretation.
Exactly. And this finding sort of echoes that, doesn't it? It
Yeah.
highlights that while AI is powerful, that deep specialization is still, well, special.
It absolutely does. It reinforces this idea of AI as maybe an augmenter, a tool, rather than a complete replacement, especially in complex fields. Definitely gives you something to think about regarding the future shape of healthcare, doesn't it?
It certainly does. Lots to consider there.